Welcome to yet another edition of COVID-19. I'm Min Sun-hee. The world has recorded more than 24 million cases, and quite a number of those who have recovered, so to speak, are now shedding light on the rather alarming after effects of the virus that even medical experts have yet to fully understand. We have more on that later on the program, but now here are the latest numbers on the pandemic with our Kwon So-ah and related news with our Kim Da-mi. So let's begin with the situation here in Korea. I hear we have more than 400 new cases on this Thursday, a number that we haven't seen since the Daegu outbreak.
Right, Sunny. It is an alarming figure, and that is attributed to church and rally-related cases, plus new cluster infections. And, you know, it's not only the capital region now, but also more increases in cases across the nation.
So 441. When exactly was the last time Korea saw this caseload?
Well, on March 7th, Korea reported 483 cases, so the highest in around 6 months we're seeing right now. And that was from the first major outbreak in the southeastern city of Daegu and nearby Gyeongsangbuk-do province due to the so-called 31st patient here in the country. And another records figure we are seeing today is in the capital, Seoul, which broke its latest single-day record of 151 cases that we saw on August 18th. And if we go over to our map, we see that we have 154 cases in Seoul today, and also followed by over 100 cases in Gyeonggi-do province and 59 cases in Incheon, which means more than 300 cases in the metropolitan region alone. And we also see a handful of other countries across the nation which have cases in the double digits, and here including the city of Gwangju, which has 39 cases, and that is due to cluster infections that are related to a church as well as a table tennis facility. And that is also why the city of Gwangju already has implemented administrative orders this morning equivalent to social distancing measures at level 3. And we will take a closer look at that level 3 with our Kim Da-mi later on. Now, if we go over to the details today, as I said, 441 new cases, raising the total to 18,706. The death toll has risen to 313, and we have almost 4,000 people in quarantine and some 14,460 people who have made a full recovery. Now, in the past 2 weeks, we have been seeing cases in the triple digits on a daily basis, going from the 200s to the 300s. Again, we had a decline to the 200s, but now we are to the 400s. And with this rise here in Korea, Korea has now become the country with the 74th highest number of infections around the world. That is up from 75 we saw yesterday. So with that, let's take a look at the global figures. 24.3 million total cases around the world, with over 281,000 new infections in the past 24 hours, with almost 830,000 fatalities and some 16.87 million recoveries. Let's move over to the hotspots around the world. The U.S., as we have been predicting yesterday, has surpassed the 6 million mark in total infections, followed by Brazil at 3.7 million and India at 3.3 million. Similar figures here in South Africa and Peru in the 600,000s. Let's move over to other places. We've been seeing a change in order here. Argentina at 370,000 cases has surpassed Iran at 365,000 infections. And those are the figures I have for now, but I'll be back with more updates after the government briefing. Back to you, Sunny.
All right, so thank you for that. I'll see you back at the desk. Meanwhile, for more on the pandemic here on the local front, Thursday's number of new cases is raising much alarm over the latest spread of the virus, as it appears to be rampant across the country. Observers are calling for tougher social distancing, but concerns over its impact on the country's economic health have authorities here cautious about hasty action. For more, I have our Kim Da-mi here in the studio with me. Welcome, Da-mi.
Good afternoon, Sunny.
Now, Da-mi, do start by telling us about the measures under level 3, which of course have yet to be announced.
Right, Sunny. So level 3 social distancing is the highest level on the ladder, and of course has many more restrictions compared to levels 1 and 2. First of all, gatherings of more than 10 people are prohibited. All facilities considered to be at high risk will not be allowed to operate. That includes amusement parks, wedding halls, art venues, cinemas, and museums. Multi-use facilities like restaurants and shopping malls will have to shut down by 9 p.m. All schools, including kindergartens, will be shut down and will switch to online classes. As for businesses, work-from-home policies will be expanded and all public sector entities will be advised to adopt remote working.
Right, some very stringent measures there. What are the chances of raising the distancing measures to level 3?
So the South Korean government has highly hinted at the possibility if the number of COVID-19 cases continues to rise. So let's take a listen.
This week is a pivotal moment that will determine whether we will need to adopt level 3 social distancing. This will cause severe disruptions in our daily activities and massive job losses, which we will have to endure.
According to a local survey earlier this week, more than half of all Koreans believe that level 3 social distancing measures are necessary. At the same time, around 40% of the respondents said such a decision has to be made cautiously. Residents in the Seoul metropolitan area were more favorable of the move compared to people in other regions. President Moon Jae-in said Korea is facing its biggest crisis since the pandemic began, calling on people to abide by strengthened social distancing rules. He said that if the number of new cases doesn't come down, the government will have no choice but to raise its social distancing measures to level 3.
3단계 격상은 결코 쉽게 말할 수 있는 선택이 아닙니다. 일상이 정지되고 일자리가 무너지며 실로 막대한 경제 타격을 감내해야 합니다. 의료 체계까지 무너질 수 있습니다. 최악의 상황까지 가지 않도록 모두가 힘을 모아주시길 바랍니다.
Right now, as the president has just said, the enhanced distancing measures will come at a heavy cost to the economy, right, Tammy?
Right. So the country's economy will be vulnerable more than ever. And to get a better picture of the potential fallout, let's take a look at the case of Germany. So Germany went into a month-long nationwide lockdown back in March and April at the peak of the COVID-19 outbreak there. Gatherings of 2 or more people were banned, aside from family outings. Restaurants were not allowed to operate and accepted takeout orders only. If keeping a 1.5-meter distances at workplaces was not possible, people were told to work from home. And all of these restrictions took a heavy toll on the country's economy. Retail sales fell 5% a month in both March and April, contributing to a 10% drop in GDP for the second quarter of this year. And experts say the Korean economy is likely to suffer a similar impact or worse. According to KB Securities, just 2 weeks of level 2 social distancing measures could drag down the country's economic growth this year by 0.4 percentage points. That figure takes into account a scenario where level 3 social distancing will be adopted for the Seoul capital region.
That is no doubt a very disturbing number. Tammy, before you go, do remind us of the measures under the current level 2 of social distancing here in the country.
Sure. So social distancing level 2 prohibits gatherings of 50 people indoors and more than 100 outdoors. Sporting events are continuing to take place, but without any spectators. Private firms are encouraged to adopt work-from-home policies or flexible working hours to really limit the number of employees at the office. As is the case for level 3 measures, venues designated by the government as high-risk facilities will be forced to shut down. That include nightclubs, singing rooms, gyms, buffet restaurants, and many more.
I see. All right, Tammy. Thank you for that coverage. Hope to see you again soon.
My pleasure.
Right, it's roughly about 9 minutes past 2 in the afternoon here in Korea, and we are poised to join the regular afternoon briefing on COVID-19. With Thursday's daily infection numbers standing above 400, health officials today will no doubt urge for complete adherence to level 2 social distancing guidelines. Now, let's take a moment now to remind ourselves of those particular measures as outlined by our Kim Da-mi a little while ago. Under level 2 social distancing, all gatherings indoors can host a maximum of 50 people only, while those outdoors can have a maximum number of 100. Here in capital Seoul, however, the number of people who can gather for a rally has been restricted to 10. Professional sports games can be held, but in the absence of fans at stadiums. Business has been halted at high-risk facilities, including buffet restaurants, clubs, singing rooms and internet cafes, while churches are required to hold online religious services only. The academic arena here in the metropolitan area for kindergartners, primary, middle and high schoolers has been ordered to go online until the 11th of September. The only exception has been extended to seniors in high school, who can partake in a hybrid arrangement of both online and offline classes under stringent safety measures. For the rest of the country, schools can adopt the hybrid approach under level 2 social distancing, of course. For those in private as well as public workplaces, teleworking has been advised as authorities urge for efforts to limit physical contact to curb infection. The briefing is about to start. We will come back to you afterwards with a summary of the key announcements with our Kwon-soa.
질문 한 가지씩만 부탁드리겠습니다.
Right, I just heard the briefing has yet to, no, it has starting right now with our Kwon Junuk, the Vice Head of KCDC.
정례 브리핑 시작하도록 하겠습니다. 먼저
First of all, we have Deputy Director Kwon Junuk with the explanation. Let us now begin our regular briefing for August 27th, Thursday, on the COVID-19 response here in South Korea. As of new local infections, we have 434, and we have 7 new imported cases. The total caseload now stands at 18,706. 93 more people have been discharged following full recovery, while 3,932 people are in quarantine. And there are a total of 46 people with severe or critical conditions. We had 1 additional fatality. I extend my deepest condolences to the deceased and the members of the bereaved family. Let us now go over our updates on our domestic infections. These statistics are as of today noon, and they may be subject to change. First of all, starting from the Headquaters Jail Church in Seongbu-gu District, Seoul City, we have 26 additional cases being confirmed from contact investigation. A total of 955 confirmed cases have been confirmed to date. As of now, in relation to this church, we have over secondary transmissions being found at a total of 23 venues. And among those, we have seen 140 confirmed cases of further transmission stemming from the church, and epidemiological investigation is underway for 186 facilities to prevent further transmissions. And next, as for the August 15th Seoul rally, we have 54 more patients being confirmed from investigation. A total of 273 people have been confirmed to date. In particular, among these group of people, 161 are in metropolitan area, and also from Gwangju city, from a church in the Gwangju city, we have found on the 24th they had the first index case, and we have confirmed that 30 more patients have been confirmed to date, and in total we have 31 patients being confirmed to date for that specific church. We confirmed through our investigation that this index case has participated in the August 15th Seoul rally, and on the next day we saw clinical symptoms. And before showing the symptoms on 18th, we found that this person has attended the religious services for twice, and also once on a different day. And through these services, we believe that the virus has spread to other worshippers. The KCDC would like to note that for those of you who have attended the Seoul rally, especially if you are at the districts, other non-metropolitan areas, to get tested as soon as possible, because we confirm that there have been a spread to 13 provinces nationwide, including Busan and Gwangju and so forth. So we ask for all of you to get tested as soon as possible, regardless of your symptoms. And this is a must, and you shall do this immediately. And next, in relation to Muhan Group, we have 9 more cases being confirmed. 56 in total have been confirmed to date. Moreover, in Kurogu district, we have an apartment building. And on 23rd of August, we had the first index case. And after that, we have seen continuous spread of the virus through families and office buildings. A total of 22 people have been confirmed to date. In particular, we have confirmed that 5 people have been confirmed within the households within the same apartment, and a total of 28 people have been confirmed. And we are conducting the epidemiological investigation for the sources of infection as well as the contact tracing. In Seoul, Eunpyeonggu, there is a hair salon which also it's titled Headquaters in Yeonsinnae district, and we have found that 8 additional cases have been confirmed to date. In total, we have 9 cases. And in Gyeonggi-do Anyang City, we have a group meeting of acquaintances. We also have additional cases of 16 people, and we have 17 people confirmed to date. And moving on to Gwangju City, in relation to a table tennis club, on the 25th, we had the first index case, and 11 more patients have been confirmed to date. In total, we have 12 confirmed patients to date. And in Gangwon-do province, at an indoor sports facility in Wonju, we have 7 more people being confirmed. In total, there are 64 patients confirmed, and investigation shows that these were related to the Myeongnyun Elementary School kindergarten, and we have found that these 2 categories were linked, and they have been reclassified. And as for the status of those patients with severe or critical conditions, as of today, we have 46 in severe or critical conditions. Those over the age of 60 are 37, accounting for about 80.7% of the total. And as for the sources of infection, in relation to Sarangjeil Church, we have 12 cases. And as for the remdesivir, at 36 hospitals nationwide, a total of 155 patients have been administered with the drug. In relation to our therapy development, in order to help our development of the blood plasma therapy, a total of more than 1,200 people have expressed their intentions to donate their blood samples, and a total of 820 have been completed with these donations. And as for the Daegu Shincheonji group worshippers, they additionally expressed intentions to donate their blood, and we also would like to thank them for the cooperation. And starting from the 27th of August to early September, we will have a special stadium in Daegu, and we will also have group blood donations there. And we would also like to thank the city of Daegu for your cooperation. And once again, my thanks also goes to the members of the Shincheonji and the religious centers for your cooperation in blood donation as well. And as for the life quarantine measures, on the Safety e-report application run by the Safety Ministry, we have seen that many reports were related to religious facilities, and they also had meetings in enclosed spaces without wearing face masks, and they also had prayer meetings together, and they also slept at the same facility for days. And also at some call centers nationwide, tens of people were working at an enclosed space without wearing their face masks. And once again, we would like to highlight that wearing face mask is the most effective way to protect yourself and your loved ones, as well as your neighbors from the virus. When you are stepping outdoors, you need to wear face masks, and you need to wear them on a proper manner. You need to wear them so that you can cover your nose and mouth. You shall not touch the surface of the mask frequently. And when you are consuming food or beverage. And aside from those moments, you need to wear face masks at all times. Last but not least, today we have also a very high number of new local infections today. And in the course of the metropolitan area outbreak, we have seen this is a new record. And also there are a high level of people, high ratio of people who are not classified. And this goes above the proportion of 30% today. And the virus is also now spreading from the metropolitan area to non-metropolitan areas. And at any places, at any time, you can be exposed to the virus. Of course, these uptick in the number of cases were partially due to a wide and extensive testings as well as contact tracing to a certain extent. Nevertheless, we believe that there are many patients under investigation with unidentified sources of infections, and they amount to about 3 out of every 10 people. And this is why we ask all of the people to get tested if you have suspicious symptoms. And we also would like to highlight that you need to continue to abide strictly by the level 2 social distancing, which is all about minimizing social contact with others. And this is the only way for us to prevent the worst case scenario going forward. Nevertheless, we have just mentioned during the briefing at the Gwangju church cluster infection. We are very unfortunate to listen to the latest developments there. And after going to the Seoul rally and being exposed to the virus before isolating themselves, they went to the services, and we have confirmed that they were physical services, and thus, this spread the virus to other church members. Once again, if you have been exposed to the infection risks, we also ask you to get tested as soon as possible. And the local authorities, they have issued also mulling over the issuance of orders, administrative orders, as well as the rights to indemnification for those who are not getting tested. And we are mulling these measures because if you delay the testings, you could also put at risk the lives and the safety of many people, especially those who are in the high-risk group, including those who are elderly. And this could lead to a large economic loss on a nationwide level, as well as a medical collapse as well. And these will be on the shoulders of ourselves as well. And yesterday at the National Assembly, there was one lawmaker who said that in Daegu and Gyeongbuk province, the people also united and they had concerted efforts to overcome the massive outbreak there. And this shall be repeated once again. We shall be united and share concerted efforts to combat the virus. The quarantine authorities prioritizes quarantine measures right now. Of course, if the quarantine collapses, we believe that other areas will also be put at risk. So we ask the local authorities to reduce the number of unidentified sources of infection. And for instance, we have mentioned the Jeonju City's public health center, the example, and we would like to highlight the need to also increase the number of epidemiological investigators. And we also would like to appeal to the medical practitioners nationwide. We believe that it is our utmost priority to protect the lives and the safety of citizens, and you shall also do the same as well. And the quarantine authorities, including myself, will have to adopt to the new normalities of the COVID-19, and these include wearing face masks at all times and keeping a healthy distance, and also washing hands on a frequent manner. So also, for the time being, it is very advisable to refrain from having group meetings and gatherings, and instead of shaking hands, you shall also pay courtesy with other forms, including bowing. And we need to protect all of our elderly patients, elderly citizens from the COVID-19. And we would like to appeal to the public as well. Thank you very much.
기자님들 질문에 답변 드리겠습니다. 사전에 보내주신 출입 기자.
Right, there was Kwon Junuk, the Vice Head of KCDC, with Thursday's afternoon briefing. So, what was the gist of his address?
Well, Kwon asked for united efforts by the nation's people at this critical stage as we have cases above 400 today. And the number of cases linked to hotspots in the country is continuing. Just to mention some updates on this Headquaters church in the capital Seoul, we have 26 new cases, raising the total to 959. And there were also 54 new cases related to the Gwanghwamun rally on August 15th, raising that total to 273. And this is why Kwon asked for people who have been at that rally and who have not been tested yet to get tested for the virus, regardless of symptoms of the coronavirus. And if you do see any symptoms and have been at any places across the country, also get tested because we are seeing how these cases are spreading to other places. For example, in Gwangju, we have a total of 31 cases related to a church, and it looks like that the first patient there was a participant at the rally in Seoul and also participated at other church services. So that really shows how these cases are going towards chain transmissions, and that is why Kwon asked for special abidance by the social distancing levels measures at level 2, but we do not hear of the level 3 measures as of yet.
Right, and hopefully we will not in the future.
Let's hope so.
Right, okay, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, we've touched upon the lingering after effects of COVID-19 a few times on our show. And today we're poised to speak with one survivor over in the US who is sharing her story to shed light on symptoms that can persist for months. I have Yvette Paz in California live on the line. Hello, Yvette.
Hi, thank you so much for having me.
Right, Yvette, I understand you're part of a support group for COVID-19 survivors. First, could you start by telling us a bit about this group? How did it come about and what does it seek to do?
Yeah, so actually it is called Survivor Corps. It started on Facebook back in March by a single mom who was home. She was diagnosed with COVID and she wanted to do something to help. At this point, we didn't have a lot of information and there was a lot of people who needed support. So that's where it started, in someone's living room, and now it has 97,000 members that can actually be accessed worldwide. So it's not just here in the US, anyone anywhere can join. And it's not specifically for survivors. This is for people who need support, whether you have had COVID or not. This is for people who are looking for information, or also just, some camaraderie within the COVID environment. So it has 97,000 members, and it is something that we're recommending to anybody who has any questions regards to COVID. And the main purpose of the group is to take these survivors and to connect them with medical, scientific, and academic researchers in attempts to find some kind of a cure, to get some sort of stability. And fortunately, a lot of us do and have developed the antibodies in our plasma. So we are encouraging people also to donate plasma, to donate blood in attempts to try to find some way to battle this.
Right. Yvette, what kind of after effects are some of the members of the group suffering from?
Well, I think the biggest one that's discussed right now is lung damage and lung issues. I myself am suffering from that. There are several different, with so many members, there's just so many different things that we hear. But the lung after effects and the breathing after effects is the #1 thing that we are hearing about months later.
Yvette, are there any particular after effects that are particularly pronounced, depending on perhaps age or gender or ethnicity?
Well, from what we're hearing so far, of course, people who have had any sort of illnesses before, the elderly, 65 and over, are having a little bit of a harder time with this. Unfortunately, it does affect the immune system. This is something, if you have had asthma or diabetes or something that you have battled in your life, it is going to unfortunately affect that, and it's going to hit you much harder. So it is something where here we are being very, very careful with the elderly. If we have any family members who have had any kind of illnesses before, we definitely want to keep an eye on that because the effects can actually stick around after COVID is gone.
I see. Yvette, could you now please tell us a bit about your personal experience with COVID-19 and its after effects? You've mentioned lung problems.
Yes. So interestingly enough, I'm only 30 years old. I have never been sick. I actually live a very healthy and fit lifestyle. And unfortunately, I was totally blindsided. I ended up getting COVID, which led to severe pneumonia. The pneumonia is what led me to be hospitalized for 5 days, and I almost passed away in the hospital. Luckily, I did not have to go on a ventilator, but my immune system was extremely low. And there was some damage caused to the lungs. Luckily, I was able to recover. I did make almost a full recovery, but to this day, I actually still have lung damage and trouble breathing, and it's been 5 months.
What is the assessment from your doctors regarding your after effects?
Honestly, they are completely puzzled. Only because I am actually one of the very first documented cases here in the U.S. There was a lot of cases, but they just haven't been documented the way I did it. So the doctors are, they're kind of amazed because they compare my previous records to the records now, and they're showing that the COVID damage or the lung damage that is in the lungs is actually growing. Even now, although I have tested negative for COVID twice, they are showing that the damage in the lungs is actually getting worse, not better.
That's really scary, Yvette. Meanwhile, as a survivor yourself who is seeking to deal with the after effects of COVID-19, what would you point to as the toughest challenge in your continuing fight, and what kind of support would perhaps, if possible at all, ease your journey to perhaps complete recovery?
It's very interesting because although this affects your body so harshly, and it really does, the biggest #1 effect is your mental health. This is something that we have seen continuously. This is something that has been a pattern, not just here, but all around the world. It starts off with, somebody contracts COVID and they are looked down upon as they are dirty or diseased in some way. Nobody wants to be around you, and you have to stay home, quarantined. And then, once the economy starts going down, finances are affected. Your family is not as close as it once was, and it kind of messes up your routine, on top of you being sick physically. So it is something that definitely affects your mental health. A lot of people have struggled with forms of PTSD. I myself struggled with PTSD and having nightmares afterwards, and just trying to figure out what happens next. How do we pick up the pieces from this experience and jump back into our regular lives when there's nothing normal or regular with what's going on in the world right now? So I think that's the biggest challenge that we've had thus far.
Right. Yvette, what efforts, again, if possible, are being made by survivors like yourself to deal with the after effects then?
Yeah, so Survivor Corps, I think, was one of the greatest things that was made because, again, it's a large community of people. We can discuss our feelings. We can talk. I mean, nothing is off limits there. And you meet people from all around the world who have gone through similar experiences. You can talk to each other. I myself was struggling, and I actually did seek out professional therapy. And it is such an amazing resource that's out there. There are people who are living their lives every day looking for people like myself and for others to help make their quality of life better, to help, listen when it feels like no one else is listening. So I think that is something that has helped me just so much in this process in regaining my own personal strength and being able to take my life back.
Yvette, are there any final words that you would care to share with our viewers about COVID-19?
Yeah, I think this is something that, unfortunately, a lot of the young people have not taken very seriously here. I think that's why the cases in the U.S. are so high, because originally it was easy to say, well, maybe it's just the elders, or maybe it's just, people who have been sick. But what we've seen here is that's just not the case. COVID does not discriminate. It doesn't care how old you are, and there's no form to predict who this is going to affect. So I would just say to all the young people out there to, pay attention. Don't think you're invincible, because I thought I was invincible, and here I am now fighting this every single day. Even now, 5 months later, I actually got sick a second time. And it's just from the after effects of the COVID. So I think really right now we need to realize that this is so much bigger than our city, than our country. This is something that's happening in the entire world. And I think we really need to come together to do our part, listen to the guidelines, that are being put out. Wear your mask, protect each other, protect your families, and the sooner we do that, the sooner we'll be able to beat this.
All right, Yvette, thank you very much for that. All the best to you, and thank you for sharing your very difficult experience with us. Take care.
Thank you so much.
이번에 추가로 승인된 8개 기관의 과제에는 인공지능 분석 모델을 통한 중증도 예측 등 다양한 연구 주제들이 있습니다.
Artificial intelligence technology is permeating nearly every sector of society with new approaches to age-old problems as well as innovative solutions to fresh challenges, especially those posed by COVID-19. For more, I have Professor Emeritus Lee Soo-young from KAIST. Welcome, Professor Lee.
It's nice. It's a pleasure to join.
Right, and I also have Professor Woo Jong-wook from California State University, Los Angeles. Welcome, Professor Woo.
Thanks for having me here in Korea.
Right. Professor Lee, let's begin with the role of artificial intelligence in tackling COVID-19 then.
Yeah, AI works almost everything to control the pandemic. For example, at the airport, AI measures the symptoms, and then also at the screen post or screen center, they make diagnosis, and they also develop how to control the pandemics. And then in eyesight, the AI speed up the development of drug and vaccine, and they also make proper use of human and medical resources to make efficient use of it. So almost everything.
Right. Professor, if memory serves me right, I remember you developed a predictive model using AI that determines COVID-19 patient health risks and predicts the mortality risk as well. Could you tell us more about this and how efficient your development has been so far?
Sure. So our Big Data AI Center developed a dashboard in COVID-19 that is composed of many charts that is based on time and geomap. It is called the temporal spatial analysis in our area. So as a user, probably as a decision maker, you could click on any location and then you can see the number of confirmed cases accumulated or the daily confirmed cases as well as deaths. At the same time, we also provide 3 days of a forecast of daily confirmed cases and deaths. So as a decision maker, you could make some preparation to take an action. Especially in USA, it has more detailed information that include number of confirmed cases per test and also number of confirmed cases per 100,000 population. So you can compare your states' the handling of COVID-19 comparing to other states. So you can see how well you guys are treated in your state.
Very vital information, of course. Professor Lee, I understand that similar endeavors are also being undertaken at KAIST. Could you tell us a bit about these endeavors there? Okay,
thank you. So we have almost 300 professors working on AI. Obviously, some of them working on the prediction of the AI. So one example I like to show is they try to predict how many confirmed or infected patients may come from one country to Korea. That means they have all the statistical data from one country. For example, the number of deaths, the number of infected people, how many internet searches are made for the corona-related keyword, etc. Then they also utilize the transfer rate from one country to Korea, including how many regular flights they have, etc. Then they learn the relationship from this data to the number of the incoming corona patient for Korea. So that is good to handle, how to control the immigration or the air flight from one country to Korea. The other two examples I quickly show is one is right now the temperature is the easiest way or most popular way to detect the candidate. But in addition to the temperature, one professor utilized the microphone array to identify the coughing and then the location of the coughing sound. That means in addition to the temperature, they can also detect the possible candidate. Myself is working on conversational agent that can walk with the people instead of the precious medical human expert need to be protected from the infection, even fatigue. So when you call to the screening center, you may be very stressed, but the other side, human, is try to calm down your stress and guide through all the required process. When the call center informed to you the positively confirmed people, they may be in panic, but the people need to calm down, make it progress. So my agent, instead of human, my agent tried to understand the emotion of the people through the phone call or video call, using the facial expression and the speech tones and the word they are using it. Then they try to guide through nice conversation to calm down and then even guide the required procedure smoothly. That's only a few examples I can show you.
That's a very intriguing approach.
Yeah.
I see. Professor Wu, how effective is AI in the field of medicine, treatment that is?
Actually, as the expertise, I have an expertise in big data and AI, so it's not easy for me to cover all disciplines, including the medical and pharmaceutical. However, I can talk in general. You know, with the accumulated data in pharmaceutical area, definitely the data can be collected and stored and analyzed using new system like big data and AI. So based on the report by Korean National Information Society agency, they said adopting AI for developing new drugs, it could shorten the developing time from 10 years to 3 years. Also, it can reduce the developing cost from $1 billion to $500 million. So that should be definitely useful if we use
financial costs. There's a lot
Exactly.
of savings there. Professor, generally speaking, what makes AI technology so effective in efforts to combat contagious disease?
The main thing is the speed of decision-making and behavior. As you see, to control the pandemics, you need to make decisions and act quickly in time. But human usually take some time to understand a lot of related data and make decisions. Sometimes they even hesitate, but AI, if you have data, AI can learn in very, very fast. For example, when people, or the baby, learn of its own language, it usually takes 2 years. That means 2 years of training data and 2 years of calculation learning process are required. But AI currently takes that only within several days. So the important thing is the high-speed computer. The second thing is the abundance of data available through internet and mobile services, because all the related pandemic data right now goes through the central server through the internet, and AI can easily access that and learn it and make quick decisions. That's very important thing.
I see. Of course, speed is of utmost importance in the fight against the pandemic. Professor Wu, Korean telecommunications company KT is developing a COVID-19 infection risk assessment model using AI and big data-based digital contact tracing technology. Among the company's financial supporters is the Bill and Melinda Gates Foundation. Do you suppose this reality reflects Korea's perhaps competitive standing in AI technology?
Oh, of course, and generally the IT industry in Korea is like 3 or 4 years behind than the United States that who lead the IT industry. But the good news is we are not the alone. The European countries and Japan, they are also behind than United States. But as far as I know, the Korean government invested heavily on AI and big data. And if the investment goes to the small and medium-sized company, and also if it goes to the university, who can increase the number of students, definitely that shows that the Korea is kind of one of the leaders who could do big data and AI.
Right, so there is a possibility then for us to raise it high. All right, Professor Lee, thank you very much for your thoughts. And Professor Wu, thank you very much for being with us in person today.
Same here, thank you.
Right, well, that brings us to the end of Thursday's coverage of COVID-19. Tomorrow, we bring you more on the latest developments and on the recent medical information regarding the virus. In the meantime, for those of you here in the country, authorities are urging for less outdoor activities as cases continue to rise at a disturbing rate. See you tomorrow.